Improving Positive Patient Identification with Scanning in a Hospital Setting by Dr. Alec Kawash and co-authored by Heather Whitfield. PPID is an important part of any hospital's quality care improvement plan. The organization's goal is to identify and improve current PPID values and techniques to minimize medication and specimen error. The purpose of PPID scanning is to ensure positive outcomes and improve patient safety. The organization utilized the PDSA cycle of quality improvement. We engaged a working group that was made of stakeholders who offered their input on processes and procedures in their respective areas. A fishbone diagram was created to ensure we looked at the project from an organizational, methods, patient, and provider and equipment materials perspective. A process map was created to capture all the steps of the process of scanning and medication or specimen. We created an operational diagram for staff who had a direct impact on results, which included managers and resource nurses. They could easily follow, but also making their job easier by operationalizing the data in their day-to-day. We wanted teams to have the tools to make quick changes as they came. Some of the interventions we implemented were identifying the baseline measurements. We instituted a review of all of the equipment within the hospital system and ensured all scanners were functioning. We ensured new staff had the appropriate training during their orientation period. Staff had daily huddles where we would discuss quality improvement strategies. We engaged and supported our resource nurses so that they could support their frontline staff as issues arose. Early in the study, we focused on our top 5 units that administered the most medications as compared to the total. Those units were given weekly automated reports on where they were the previous week and a monthly roll-up. We ensured that the reports would go to resource nurses, managers, and directors. Reports demonstrated results on the individual level for weekly, monthly, and unit level. We wanted to ensure that staff were seeing the data and taking action on it to improve results, hence improving safety. Our support structure expectations from managers and resource nurses were to review metrics, engage the team, address performance, and report barriers. This support structure all tied back to the leads who were responsible for tackling complex challenges as well as change management strategies.
When we look at our results over the past year, we can see that our current rate of 70% across the organization is quite an increase from the same month last year, which is an 18% change. It was also important for us to look over the past few years. So we looked back to when we went live with our new electronic health system. And looking at our organization in the yellow, we can see that it was influenced by some external factors like the first wave of the pandemic. It also allowed us the opportunity to compare to another organization to see that a consistent 80% target is achievable. We also wanted to look at the data separated by nursing units. So we were able to see how some units, such as an inpatient care unit, would have more predictable, stable workflows and present different challenges than, say, ICU or the emergency department. We also looked at our provider distribution, looking at the top 25% of users who have a scan rate of about 93% compared to the bottom group of users who their scan rate is still about 13%. Next steps is we'd like to focus on some of the hard to reach areas and groups of staff. This could be for sure our emergency department and our ICUs who have those unique challenges. We also aim to transition from our project mode to more general operations as we start to provide reports on a monthly basis instead of the weekly that we've been doing. Lastly, we seek to maintain our safety culture within the organization, keeping our engagement with end users high to identify barriers and come up with solutions so that we can have a shared responsibility throughout the organization on increasing our patient safety.